Hello, welcome to this month's live. Very happy to have you here. It is all about neuroinflammation. So we ran a poll on YouTube, and neuroinflammation was the most requested topic to talk about. So we'll dive deep into it today. If you have any questions, please put it in the chat. I will keep an eye on it. And let's see. Yep. So if you have any questions, put it in the chat. I love questions. I love helping out. When parents are stuck, we can certainly follow up on things that were done previously, other questions. But if you see my eyes diverting over, it's because I'm looking for comments or anything. All right, so let's just get straight into neuroinflammation. Neuroinflammation, the simple way to think about it is neuroinflammation is the brain's version of an immune response. And we want an immune response that is certainly beneficial. You can think of inflammation as that first defense, right? It is how the body and the brain defends itself against threats, perceived threats. Sometimes when it gets into autoimmunity, like what is tested in the FRAT, and then other aspects that can be actual threats. So we'll definitely get into the different triggers and stuff like that. So in children with autism, the reason why you hear inflammation as such an issue is when this inflammation becomes chronic, right? So that perceived threat or that threat doesn't clear, it doesn't go away. And then the body is stuck in this cycle of inflammation. So when inflammation increases, then that's when neuroinflammation can really become a problem. So it's not that initial response. We certainly want our body to have that immune response. We're not trying to be entirely anti-inflammatory in the sense that our body doesn't have an inflammation response. We want that response. We just don't want that chronic exposure to whatever is causing that inflammation. So it's really important to understand that difference. It's when it's the chronic inflammation. That's what the brain has experienced, this state of irritation. And obviously it's in children. So that's going to affect development and behavior and that negatively, right? Not positively. Okay, so I see lots of questions about how do I know if it's a problem for me? And let me see, how do I know if it's a problem for me? And how do you test for it? So you're asking great questions, and that is definitely what we will be getting to. So I just want to be on the same page as to what inflammation and neuroinflammation is and how it's really that chronic exposure, that chronic state of inflammation that we're focusing on because that's the undesired inflammation. We want that initial response, but we don't want to keep it chronic. And then you can start thinking about, okay, what is that chronic exposure for my child if neuroinflammation is an issue? So just keep that in mind, that neuroinflammation is really coming from something that is chronic. Okay, so let's see. Yep. So I have not gone over into what has worked yet. We're just establishing the fact of what neuroinflammation is. It's that chronic exposure. So let's get into the triggers. Okay. So what is causing this? Because I know that was one of the questions. What can potentially cause this chronic state of inflammation? And it's not just one thing for everybody. And this is where autism gets complex. For most people, you just have to understand all the different potential triggers and how they all relate. So common contributors to neuroinflammation include gut dysbiosis, right? And that's a big category. That can be gut infections, that can be opportunistic gut infections in the gut, but due to something else, right? So gut dysbiosis of itself is something that has to be addressed, but you've got to understand what is the cause, right? So why is the microbiota so shifted. Diet also plays a role. So if you're not eating foods that actually nourish the microbiota, that's when you can have issues as well. So gut dysbiosis is a big category, and there's a lot to think about. So if you have specific questions on gut dysbiosis, certainly put them in the chat. But that is one category. Another category that can cause neuroinflammation is viral or bacterial infections. And this is something that a lot of people think about more when they're thinking about PANS and neuroinflammation, but it's really any viral or bacterial infection that the body doesn't ever clear. Viruses, right, we're going to retain that in our bodies, and sometimes it's a viral load that the body can't really manage. But this is important, right? So you would want to know what viruses your child has or bacterial infections. Treat the infection, right? And then understand, okay, is there sustained inflammation in the brain after the infection has been cleared? So this is the way you want to think about it. Environmental toxins, right? So we have different chemicals, we have different pesticides, different heavy metals, right? So this is toxins that are in the body, and especially if we're continuing to be exposed to them, right? Then our body can't really ever detox entirely, right? If you're detoxing but being exposed, and detoxing, and you have like a net zero. You're just paddling in place. So environmental toxins also come from the food we eat, right? So this is where neuroinflammation can get very complex, but you want to start to think about it in the context of your child. So if you've gone organic already and you've looked at your water source, right? Like even things like fluoride in tap water and some even bottled water, right? That could be a toxin for your child that is causing neuroinflammation. These are all things to really think about. And mitochondrial dysfunction. There's a variety of different tests to understand mitochondrial dysfunction. Some doctors go straight to it and start treating mitochondrial dysfunction. Whereas other doctors look at, okay, these other larger triggers and then clear those and then address mitochondria. Some kids have just mitochondrial issues. So this is where these are all common triggers. And it's important to really exhaustively examine each one of those categories to make sure your child is not dealing with those issues. So mitochondrial dysfunction it's in a category itself, but then underlying that can be something that is impacted by something like a viral infection, right? So if you have a viral infection, then it can cause some issues with the mitochondria, which then really impacts inflammation even more. So some kids can have a viral infection without mitochondrial dysfunction. Some kids will have both. So again, it's really important to look at these categories, understand them, and make sure if they are relevant for your child that you go in and focus on them. So these are all different stressors that really can overwhelm the body. And then if these issues aren't resolved, that's when it gets into that chronic state, right? So we're all exposed to heavy metals at some point. We all get different viral and bacterial infections. How well does our body clear it? What are the other burdens that it has on it? And then if that inflammation state remains, that's when it becomes chronic. That's when you'll see other issues in the body, as well as neuroinflammation. And again, our kids are developing. We don't want neuroinflammation to be their sustained state of the developing brain, because it'll impact it. And another thing to think about, just to cover all common these triggers, is genetics, right? So we've been talking a lot about the environment. Genetics does play a factor for some kids, right? Some kids have genes that don't necessarily support detox fully, right? So you can see, all right, this child might have some issues with detoxing. Now that's going to be very unfortunate if then they're exposed to the environment that has a lot of toxins in it, right? So their impact, their neuroinflammation, that chronic state, is probably going to be larger and quicker in the sense that they'll reach it because genetics is playing a factor in that. So these are all different things to think about when you're trying to understand neuroinflammation. Science, yep, definitely there is science. We've got a question about what does the science show? So there's been a lot of research in the autism population looking at different inflammation markers. So research, you can understand inflammation in the brain by doing different blood tests. You can also understand it by doing the cerebrospinal fluid. That's a spinal tap. That is not something that is done commonly. You'd have to have a really good reason as to why you would do something invasive like that, and not be able to answer that question with blood work. Obviously, you can do urine tests and stool tests for some of those other triggers that I mentioned. But research is really showing that if you're looking at different markers in the blood, you can see elevated states of inflammation. And sometimes that inflammation is at a high level, even decades, right? So you don't exactly know when did that inflammation start, but if you measure a 15-year-old and they have this elevated state, they might have had it for 10 years or so. So for some children, neuroinflammation is just a reaction to something, and then the body can handle it. But if the body does not shift out of that inflammation state, that's when neuroinflammation really becomes a problem. And you can start to see changes in behavior. I think that was one of the questions here. Yeah, Justin, how do I know if it's a problem for me? So this is when you're starting to think about maybe increase in irritability, sleep disturbances, right? And that's common. I think around 70 to 80% of people with autism experience sleep disturbances at some point. And many times it's due to some of those initial triggers. But then if you don't get on top of those triggers, that's when it moves into the chronic state of inflammation, and you start to get and experience more of that neuroinflammation state. And that's what the research is focusing on. So sensory overload, that can also be a sign of neuroinflammation, even regression. So a lot of these common behaviors that we see in kids with autism are associated with neuroinflammation, and the research shows that neuroinflammation is an issue. Not for everybody, right? And that's the tricky part of autism, right? So it is complex, and there's many different variables which can make the child's behavior not be cookie cutter, not be exactly the same to somebody else. So these kinds of behaviors are signs of a nervous system that is overwhelmed, and that inflammation state really needs to be looked at. Okay, and if you have more questions, certainly put that in the chat. Okay, and we could keep going on. Let me just, okay. All right, so we have tests and stuff like that. So we're getting into that. First, we can talk about interventions, right? So what works? You really always want to start with the least risky. And this is when you're going to hear about diet changes. And I know everyone's like, oh, diet changes. People talk about it because it actually makes a difference. And I understand the difficulty in it. I was one of those parents who was like, gluten-free. Oh my gosh, come on. I do not want to. Like, I just don't have the capacity to learn and do all that. But diet is one of those contributing factors to inflammation. So if you really want to start somewhere safe, somewhere logical, somewhere where your money is going to be very well spent and go far, diet is that first step. It really is. And then you can start to get into some basic supplements like the omega-3s, right? So omegas and the fatty acids and all of that. it's done for a reason, right? So a developing brain just kind of like sucks up all those fatty acids and it loves it. So you want to help your child develop, and if inflammation is a problem, then really diet and some of those really simple supplements, for example, omega-3, is really, it's the right risk benefit ratio that you want. And it really covers a lot of bases, right? You don't want to spend a ton of money on different tests and doctors and supplements and stuff like that if 50%, 60% of the problem could be resolved by changing diet, right? So I don't know the percentage for each child and everything, but it's a lot easier when you take the larger issues and just get them off the table and be like, no, diet's good. Food is not causing inflammation. So that is one of the most basic interventions, right? And gluten-free, why do people go gluten-free? It has to do with the whole mechanism of action, right? It makes the body more permeable, and that in itself can contribute to the inflammation. So if you have different food particles, or if you have different metabolites from bacteria that are in your gut and they're able to get in the body, whereas if your child was gluten-free, that the body would be less permeable, it would decrease inflammation just from that. So it's certainly very simple approach. And these have been studied, right? So omega-3, this is science fact, right? You also can get into something like glutathione, which really helps the body detox, right? And that can help with the inflammation if the trigger is a toxin, let's say like an environmental toxin that can be excreted. If it is viral, right, not so much. So that's why, again, you really want to understand what are the causes for the inflammation. And if you do like the scientific approach that we here at Navigating Autism takes, certainly click the link. There is the autism.co work together. And if you click on that, you can have an appointment with me and we can explore how we work together. I work together with parents on the Navigating Autism platform. We have a really great time learning and taking action and celebrating success. So we're really building a great community around science. How do we make sure that we're covering what the science shows and taking that logical step? So if that's something you're interested in working with me further, I would certainly love to welcome you onto the community. Okay, so let's get back to just things to think about. So neuroinflammation, there's sometimes ibuprofen. You might have heard of doing different ibuprofen trials. Ibuprofen is great in that it can reduce inflammation. And many times functional medicine doctors use it for like a week trial. So if you wanted to understand, okay, is neuroinflammation a real issue? That's one of the ways that some doctors do it. But you want to be cautious because it's not something that can be done sustainably. And there is no, like 1 week fix for neuroinflammation. This is not something that's just going to be magically fixed in 1 week that you could kind of like power through. So just really be careful when you're trying to weigh out that risk benefit. There's no miracle cures. This is not something that's just going to happen overnight. It certainly can happen in a short amount of time, but you want to really make sure you have that risk reward ratio measured out. So to get to different tests, so you could do the different trigger tests that I had mentioned at the beginning. Those are certainly important to do. Some of the blood work that can be done to measure inflammation would be something like their high sensitivity C-reactive protein. So it's usually HS in lower caps and then CRP. So that gives an overall indication of inflammation. A lot of times it's really more centered on cardiovascular, but it's definitely a standard inflammatory marker. And when I say standard, this is probably not something your pediatrician would routinely run, right? Because pediatrician is not really the doctor to go to for if your child's in this chronic state of inflammation. They might have been the doctor you went to for, if it was a viral or bacterial infection, they might have been that initial, but their expertise isn't really to understand inflammation and chronic inflammation. If your pediatrician happens to be also an integrative pediatrician, that's where you can probably have the discussion, but they might not necessarily be an expert in autism, but they at least will have a bit more of a different approach of, okay, let's think about this long term. If you're going to your general pediatrician, like a 10, 15-minute appointment, they're probably not routinely ordering C-reactive protein. And if you ask them, you might get some pushback on that. You can also look at the ESR. So again, this is looking at general inflammation. It's not necessarily specific to the different triggers that I mentioned, but these are some standard blood tests, usually in the US covered by insurance, right? So a lot of those specialized triggers that I've been talking about, those are specialized tests, typically not covered by insurance. You want to use both medical systems. So you want to use functional medicine and you want to use conventional medicine. You want to use it all. So something like the ESR would be another blood test that you can do to get an understanding of inflammation in general. And then you could start to get a little bit more specific. So again, it would depend upon, all right, what are the actual triggers? Is something that is really involved in inflammation. And the research, a lot of different research publications in autism, when they're trying to measure, okay, did we have an impact on inflammation? A lot of times they're measuring TNF alpha. And so that number is important because it is implicated in blood-brain barrier dysfunction. So if you want to start to understand a little bit more about inflammation, specifically into the brain, TNF alpha is something that is done. And again, your general pediatrician probably will tell you, absolutely no, I'm not going to do that. Because these are starting to get very specialized. And the thing is, they might be like, I don't mind ordering the test, but I have no idea what to do with it afterwards, right? So it's like, you could get the test done, but you really want to take action on these items that you get from labs. And they're really good in the sense that then you can have numbers to measure towards and measure progress and see how well different treatments are working. So TNF alpha would be one of the tops. Interleukin 6 is also one of those more specialized blood tests that can really understand neuroinflammation. So interleukin 6. You could do some other interleukins, so different cytokines and things like that. Interleukin 8 is definitely done often as well. And there's different research publications that use different interleukins to measure how effective a treatment is. So sometimes you can just do a cytokine panel. That's why I was referencing that in the beginning. Okay, so those are the tests. Let me circle back to the questions and make sure we've answered. So if you have any questions, just put it in the chat so I get to know. All right, so this was, how do I know if it's a problem for me? So again, you can start to look at the symptoms, right? So the symptoms that we went over, do you have any of those? Or you can start doing some of these tests. You could certainly start with conventional blood work. If blood work is easy for you to do, then you can start there. So, or if you know, right? So if you know you have a viral or bacteria infection that never fully cleared and you have these kind of flares, right? So if you're like, oh, 4 times a year, I don't know what happens, right? That gives more of an indication of inflammation. So really just look at the behaviors or start to do the different tests. And if that hasn't answered your question, then just put more into the chat. I'm happy to talk about this more. All right, let's see. How do you test it for kids below 10 years? So, when you got to get blood work, you got to get blood work. The alternative is, well, I'll try this and I'll try this and I'll try this and I'll try this and I'll do this and I'll do that. And before you know it, 5, 10 years have passed and it feels like you haven't gone anywhere. So how do you test for kids below 10? Really understanding their overall health. So using the different functional medicine tests. This is exactly what we do in the Navigating Autism platform. So if you want structure, if you want to do this logically, then certainly click the link and explore working with us. But that's how you test for it. So it's different urine tests, different trigger tests, and the blood work is definitely important to do as well, because again, you want to measure progress in what you do. How successful was something? Is it moving the needle at all? That really helps with motivation, right? When you have a number, sometimes that initial number is high, but then there's a relief of, okay, at least I have something to focus on, right? Maybe other doctors have said, oh, that's just autism, right? But then you do different lab testing, you're like, wow, okay, no, that number should not be that high. Let's work on it. And then you work on it, retest, see the number. And it's really very logical in the sense of doing that. So doing the tests, I think, is really important, just so you have a set strategy and you're not wasting time. Okay, so did you go over what actually works? So what works for inflammation, a lot has an impact on what the trigger was. So some of those general things, diet is going to impact virtually everyone. A non-inflammatory diet, right? So no processed foods, low processed foods. You've got to be realistic. We're parents here. We've got so many responsibilities. So it's making as good as diet changes and choices as you can. But that is something that works universally for most people. Things like the omega-3s. So a lot of those supplements that are nourishing, so coconut oil, MCT oil, those kinds of things. Different spices, right? So curcumin, that is something that can certainly help. So those are all low risk. There's a whole basket of those low risk interventions that actually work universally and make sense to do first, and then get more specific and complex, but use science to get that specificity. Because again, otherwise you just really waste too much time. It's frustrating, certainly, to waste so much time of your child's development on trying this and that. So you want to be focused, you want to be logical. Okay, so we did touch upon this. What tests can be done to see if there is neuroinflammation? Are those actually needed, or can we assume? See, I'm not really a fan of assuming too much, because it can take you down the wrong rabbit hole. And I've seen parents who have spent, a year or two focusing on doing something that when they do a lab test, they realize, oh my goodness, that was the wrong place to focus. So I'm definitely an advocate for tests, for conventional tests, for functional medicine tests. The functional medicine, when I say functional medicine, it's really getting at the root cause. So something like the interleukin-6, right? That number is out of range. It's going to tell you, okay, there is neuroinflammation, but it's not going to tell you what is the cause of it. So you want to use both of those systems together, because that's where you get that synergy. So you can use functional medicine tests to really isolate what the trigger is, what the cause is, but then you can also use the conventional medicine tests to really isolate and see how effective your treatments are. And you might want to start with some of those conventional medicine tests because they're covered by insurance, right? So you really want to maximize your your impact. And if insurance will pay for it and you have a doctor who will order it, then you want to use it. Okay, let's keep going. And if you have more questions, just pop them in the chat. Okay, this one is, my son sometimes taps his head with his hand, like a potty or tapping. Could this be a sign of neuroinflammation? Just that one behavior of kind of like tapping the head, I wouldn't say it would be like your telltale sign of neuroinflammation, because he's sometimes doing it. He could have a headache. Not all headaches are related to inflammation. That chronic inflammation is what we're talking about. There could be a variety of reasons as to why he's doing that. So it could be health reasons, it could be behavior reasons, it could be he wants to play and have fun, it could be he notices when he taps his head, maybe somehow you get attention and you start looking at it. So there could be a variety of reasons. What I would do in that instance is really understand, and this is an ABA tactic, but this is one of the ones that I absolutely love. So the behavior is he's tapping his head. So I would try and get 10 data points of, okay, when he taps his head in the like 15 minutes beforehand, what was he doing? Right, so maybe 15 minutes beforehand, well, you can drop it in the chat if you want, but maybe he was 15 minutes beforehand, he was eating some food, right? So he was eating his favorite snack of something or other. And then 15 minutes later, he's tapping his head. Now you can look at the consequence. What does he get from tapping his head? If he's not getting anything, maybe some of what he was eating was causing some inflammation, right? But I wouldn't make a 100% assumption on that. I need data points, right? So that's why you want to at least get 10 so you can understand what is the correlation of him tapping on his head to the consequence. What does he get from that? If every time he taps his head, then you ask him, what's wrong? Are you okay? And you have 10 data points, then every time after he taps his head, you ask him that question, and then, I don't know, maybe he cuddles in your arms or something, then you know, okay, somehow he has learned whenever he taps his head, I get worried about him and he's doing that for attention. But again, it could be something else. So you want to get at least 10 data points. And then that way, a lot of times when I work with parents, that's what I ask. All right, give me the data. Let's take a look at it. And sometimes it can be 2 or 3 different things as to the reason why they're doing that. But it's important to understand it. So I would not say just, you know, he taps his head. Is that a sign of neuroinflammation? I would say you need a lot more data, and I would start doing some of the tests. Parent intuition is something that I hugely value. So that's why I'm not saying, oh, that's totally wrong, because I'm not there. I'm not living your life. And that intuition of, oh, you know what? I think neuroinflammation is an issue. You might be getting that intuition from other things that he's doing in the day. And you know, the question to me was just about tapping his head. So I certainly do trust your intuition. And I would say start looking at doing these different tests so that you can really quantify what the issue is. This way you don't have to wonder. Okay. Another question is this inflammation just in the brain, or could it also be inflammation in the nerves of other organs in the body? Okay, so yes, inflammation can be systemic, right? So there can be instances where the inflammation is higher in the brain than systemically. It certainly can be the case that there is systemic inflammation in the entire body as well as the brain, so kind of like same levels. So some kids with autism have inflammation, and it's really related more to their body and not so much their brain. It's not an answer that is universal. But inflammation, when you're thinking inflammation, definitely considering the entire body is important because it's all related. And if there's inflammation in your brain, it's going to impact the rest of your body. We're just all connected like that. So again, that's why, something like diet and changes along that impact the entire body, which is really important as that first step. You can start to get into like fish oils. You have DHA and EPA, right? So the ratios are really important. And when you take something that has a higher DHA than EPA, typically that decreases inflammation in the brain. It has more of a focus in the brain than systemically. So typically, if you look at some of the real common fish oils, your EPA will be much higher than your DHA. And the reason for that is the EPA is really impacting your entire body. So a lot of times when you're doing, we're getting really into the very specifics, right? So when you have inflammation and you're doing a lot of this base stuff, you start with a fish oil that has a higher EPA versus DHA. And then as you start to get more granular and specific, that's when you can switch to a supplement that has more DHA than EPA. And you would have more focus on the brain. But again, you start at the basics and then work your way up. All right, well, let's see. I don't want to miss some questions. We got, okay, let me go back. All right. Let's see. I've got lots of questions, so I'm just kind of sorting through it. Okay. Let's see. My son, let's see. My son complains of abdominal pain after eating breakfast on most days. Sometimes this pain is relieved by bowel movement. Any thoughts on the cause and treatments? So since the pain is relieved from a bowel movement, does he poop every day? That would be something that is important. So if the pain is just coming from the discomfort of having to poop, then you would want to make sure he's pooping regularly. So sometimes kids, they feel the world differently. And so what it feels like when the bowels start moving sometimes can feel like pain. At least uncomfortable, right? And so we don't know exactly sometimes how our kids experience those feelings. So I would really try to understand, is the pain coming from just that urge to poop, right? Because once you eat, then you kind of get things moving typically. And so when he poops afterwards, the pain is relieved by a bowel movement. An experiment to do to say, okay, is it the food that is causing the pain, would be to give him that exact same food later in the day. And if he's okay, then you can start to say, all right, then probably that pain isn't like one-to-one associated with the food because I give it to him in other times of the day and it's not a problem. And do the like exact same meal quantity, all of that. So you would really want to start to understand is it just the uncomfortableness of the bowels moving that might be what the issue is. So that is how I would go that, right? I think we have Time for one question. Uh, there's a lot coming in, so I can't. Uh, okay. All right. So there's a question about more about pooping. Okay. So there's some supplements that um, some supplements are causing overactive bladder. And there's another comment here about sleep and relating to urination. So sleep is really important for neuroinflammation. So I guess let's just talk about that briefly in the 3 minutes or so we have remaining. So let me put this down. So during the night, that is when our brains do detox separately, like from our body, right? That's the cerebral spinal fluid. And again, that's why sometimes cerebral spinal fluid is used to test and understand different information and things like that. It's very invasive, so it's not something that is commonly done. But sleep is really important in this whole equation for neuroinflammation. So thanks for asking that question. If a child's not sleeping, then what the research shows is autism symptoms increase for a variety of reasons. Like when we don't sleep, we're not feeling good. We don't have patience. A lot of times our thoughts tend to get more negative. So sleep is definitely an important factor to neuroinflammation. And that was one of the triggers that I mentioned in the beginning. So we're coming full circle on that. And if you're not sleeping well, your brain is not entering into that full cycle of detoxing and cleaning up. And the brain is absolutely phenomenal in how it grows and how it takes care of itself, how it protects itself. So neuroinflammation is something that can greatly be increased by not sleeping well. So in the beginning, melatonin, right? That's the go-to supplement, and it's for a reason. It helps the kids sleep for sure. It's not something that is really sustainable for the lifetime, right? So again, it's about doing something in the immediate term to resolve some issues, but then really having that focus on that root cause and those triggers and how is that really impacting everything else. So definitely giving supplements to help for sleep. There's a variety of different ones besides just melatonin. There's great herbs, valerian, passion flower. There's definitely a lot that can be done. So making sure sleep is something that is consistent and all throughout the night is something that really impacts neuroinflammation as well. And it's certainly important to get quality sleep, both you and your child. So that will close us out on the live for this month on neuroinflammation. Thank you very much for all the questions. This is definitely a hot topic, and I enjoy teaching it. And just again, the real important part is to be logical in your approach, being systemic and understanding what am I doing, why am I doing that, having different lab tests so you have that focus. And that's really what's important. You don't want to start, there's many causes for neuroinflammation. There's many ways to reduce it, right? But you want to get very specific. It's totally possible. It's not so mysterious. And thank you very much for being here. And I'll see you next month. Bye.